Welcome to the Preventative Services Program. After viewing this informational PowerPoint, please contact the oral health consultant in your area for more information on how you may implement this program in your school, district, or community. Thank you for your interest in our program. The intent of the Preventative Services Program, also known as PSP, is to mobilize a community toward protecting the oral health of its children. People across Missouri are gathering together for PSP events to make a difference where they live. Unlike most school-based programs, PSP is not dependent upon free and reduced lunches, but rather available to every child in every school district in the state of Missouri with parental consent. Basically, it's a toolkit for an oral health program available to any community or school district interested in initiating such a program. The program is based entirely upon community support and requires volunteers from the community. Essential to the success of the PSP is the community-wide involvement of various groups toward this common goal of children's oral health. Examples of these groups include schools, child care facilities, dental professionals, hospitals, and businesses. PSP has 4 components. The first component is surveillance. A screening of the oral health of a community's children is conducted once per year by a volunteer dentist or dental hygienist. Information is gathered and entered onto a standardized screening form, then sent back to DHSS, where it is entered into our database. This information is important as it will help establish the status of Missouri's children, enabling the state in identifying the needs for services and/or intervention. The second component is oral health education. This is provided preferably on the day of the screening. To help implement this portion of the program, the DHSS has developed some downloadable oral health educational PowerPoints, grades K through 12. These PowerPoints can be saved on a flash drive and shown on a laptop. After the educational piece, the children will be provided with verbal instruction on proper brushing and flossing techniques. A free toothbrush and toothpaste are provided to each child participating in the program. The third component of PSP is prevention. To prevent dental decay, fluoride varnish is applied twice each year by trained community volunteers. The first application is provided on the day of the screening, with a second application following 4 to 6 months later. The fourth component is referral. Children identified as needing early or urgent treatment are referred for care. The program is designed for children of all ages, infants through high school. You will be one of many involved in a PSP event. As you can see from this chart, it takes many hands working together to implement a PSP event. Dental professionals serve as the screeners. Parents, nurses, and others interested in assisting apply the varnish. Volunteers can be utilized to assist students to and from the event area, as well as help with paperwork. Of course, there is room for others to do education, hand out materials, and assist as recorders for the screeners. As part of the PSP, we have established some roles and responsibilities for both the state as well as each community interested in participating in the program. The Oral Health Program provides the items listed above. Why should you consider PSP? Because dental decay is a serious problem for Missouri's children. The evidence is clear of the need for oral health interventions for our children in Missouri. Let's explore some of the questions that you may have about PSP. Although water fluoridation is a major public health achievement, according to a recent statement and endorsement made by the Surgeon General at the 2013 National Oral Health Conference, dental decay is still a serious oral health issue. So you can see the importance of promoting and implementing a comprehensive oral health program in your community. Fluoride varnishes are effective in preventing tooth decay in both primary and permanent teeth. Fluoride varnish can reverse early decay and can arrest active decay lesions. Fluoride varnish promotes the remineralization of tooth enamel, making it resistant to tooth decay. Fluoride varnish is readily adaptable, requiring no special equipment, and can be applied in a variety of settings: school classrooms, library, or gymnasium. Fluoride varnish sets on contact with moisture or saliva, reducing the risk of ingestion and therefore recommended for all ages. Fluoride varnish is a cost-effective preventative measure against tooth decay. Fluoride varnish is endorsed by the following associations: American Dental Association, Association of State and Territorial Dental Directors, and the Centers for Disease Control and Prevention. Please know that the dental screening is not meant to be a thorough clinical exam. No radiographs will be made. This screening will not result in a diagnosis or a treatment plan. The screening is designed to identify obvious oral lesions and initiate referral, as well as provide a profile of the oral health of the children in a community. The varnish is painted on all the surfaces of the teeth with a disposable applicator. The process takes approximately 1 to 4 minutes for each child. The Department of Health and Senior Services Oral Health Program provides free of charge many of the supplies that are necessary for a PSP event. These include screening forms, disposable mouth mirrors, fluoride varnish, toothbrushes, toothpaste, floss, and educational materials. These will be ordered by you through your assigned oral health consultant. These supplies should be provided by the school nurse or PSP event facilitator. Face mask, latex-free gloves, and a light source. Please check with the PSP facilitator to determine if you will need to supply any of these items. Choose an area with good lighting that has access to chairs and tabletops. The screening forms used to collect information are to be completed by someone other than the dental screener. Therefore, it is essential to have someone assist the screener by recording the findings onto the screening form. Self-addressed, postage-paid envelopes are provided to send the completed screening forms back to DHSS. PSP has been a success in many areas throughout Missouri. In the 2012 through 2013 school year, over 72,000 children were screened and provided with oral health education, fluoride varnish applications, and referrals for dental care. The end result: happy and healthy smiles. For more detailed information on the Preventative Services Program and to find an oral health program consultant nearest you, please visit our website at health.mo.gov/blogs/PSP.